our attention to Dr. Kevin Kavanagh. Dr. K is founder of a national organization called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
I understand the CDC has some new masking guidelines. I said mandates, and that's not the right word. That's the word that gets everybody mad. CDC has some new masking guidelines. Can you talk about that?
They have, and it's not so much that the guidelines have changed, but who and which counties have to follow them have changed. For example, prior to last Friday, 95% of the counties in the United States were in the red zone. Today, only 30% are. Unfortunately, living in Kentucky, we are not doing very well compared to the rest of the nation, and almost all of our counties are in the red zone. There's some that are in the yellow. And these recommendations, I think, are going to be very controversial. Instead of basing them just on cases, in other words, number of cases in the community, they're basing them on hospital beds and hospital capacity along with cases. And the problem with using hospital capacity, and we've talked about this many times over the last 2 years, is that hospitals are a lagging indicator. And by the time you reach a point where the hospitals are starting to fill with COVID, you're many weeks into a surge that now's been undetected, and you'll continue for weeks to have cases that are increasing. So I'm not sure that this is the best to use. Also, there is a problem of the 2.7 or 3% of people who are immunosuppressed in the United States. In the yellow category, the CDC says that people should be wearing masks if they're around immunosuppressed individuals. The problem arises, what do immunosuppressed individuals do when they go to the store and go out in the community where people aren't wearing masks? And so that's something I don't think they've come to grips with yet, and there may be some pushback on that. So overall, things are relaxing, and certainly the rates are looking very good in the United States as a whole. They're coming down precipitously. Kentucky's the same way. But we do have some pretty disturbing variants over in Europe, the stealth Omicron variants, and of course that mutation we talked about, the H78Y mutation. And we don't know if they're going to hit the United States or not. And so should we be letting down our guard at this point and really not having an early warning system? I would be more, as you know, on the conservative side and think maybe we should still loosen a little bit on what we're doing and letting up, but we shouldn't be changing our system of monitoring and alerting the public.
What about booster and vaccination recommendations?
Well, this is something I think that we really need to look at. First of all, these are changing quite rapidly. I looked at a flow sheet, and it's even hard to comprehend when you see it in writing, so it is hard to articulate it over the radio. I certainly would talk to your doctor if you have any doubts or questions. But number one is if you're fully vaccinated, that means 2-dose vaccine, and you're more than 5 months out, you're going to need a booster for these variants. You need to remember that vaccine was made with the original Wuhan variant of the virus. Now, if you've had a previous infection with Omicron, you probably will have better protection than a vaccine. So all of you people on the vaccine booster mandate can, I guess, rest assured that your protection's better, but unfortunately, it's not good enough. You need to get vaccinated again to get a booster and get in that super immune category. If you've had a booster and you are several months out and you are at high risk, especially if you are immunosuppressed, you may be a candidate for a second booster. So you need to talk to your doctor about that. Certainly, if you're on immunosuppressants for a transplant, you need to think about getting a second booster if you're more than a few months out from your first booster. And the other option that we talked about on Friday is using that Evusheld. And that is a drug which can be given prophylactically, and it can give you protection for hopefully up to 6 months. And so that's another important thing to do. And in that regards, the FDA has just increased the dosage recommendations. They've actually doubled it for Evusheld. And that really, I think, underscores two things. One is there may be now a supply shortage because they're going to have half as many doses if you double the dosage. And you need to go down and get this if you're a candidate. But the other is that these new variants have an immune avoidance type of property. And it's something that we need to keep our guard up and our immunity as high up as we possibly can.
You got some information this morning, too, about new research pointing to Wuhan Market as the origin of the pandemic. What's that about?
Yes, there are two papers that have recently come out. One was from the Chinese CDC, and this purportedly reported on swabs which they took just after the outbreak of the pandemic, and they looked at these and they found the original virus RNA in the Wuhan market. And so that is something that would add to the category of, well, maybe it occurred there. The other is a very large epidemiological study where they tracked the first 156 cases, where they occurred. These were cases which occurred back in December of 2019. And these 156 cases were pretty much centered around the Wuhan market. And this study was done by Oxford, University of California, UCLA, Glasgow, University of Sydney, Australia. I mean, it was a huge study, very prominent institutions. And this is the one that really has caught people's eyes that, yes, maybe this has come from the Wuhan market and that it wasn't some bioweapon that a lot of the conspiracy theorists are thinking of. And so I think the idea that this is a bioweapon probably isn't realistic. This was possibly a lab accident that it broke out of, but right now the evidence is shifting that this actually came from nature through this Wuhan market.
Always good to talk to you, sir. Have a great week, and we'll talk to you on Friday. Thanks.
All right. Thank you, Jack.